I'm Dr. Phillip Chang at Aesthetica Cosmetic Surgery and Laser Center. This is Christina. We're going to do a demonstration today on Botox. Right now we're going to try to treat some of the lines on her face that she doesn't like. Okay? She's obviously pretty, but there's certain things that she doesn't like, which is the lines over her, the horizontal lines over her forehead. Christina, raise your eyebrows. Okay, those lines. Her angry lines, called the 11s, or she calls them her girl lines. And then her crow's feet lines, which honestly she doesn't have too much of, but when she smiles, big smile, okay, you can see some of these lines right across here. And so those are the three main areas that we do Botox for. Without any numbing, she can demonstrate that this really is a relatively painless procedure. So we're going to do this area right across here. And so you can see one shot here. And we'll do it on both sides. So I'm very result-oriented, and what that means is I sell it by the area. If it doesn't work, you can come back and we treat it again, as long as it's within a reasonable time, and we usually put a limit on that of about 2 weeks. If it hasn't worked in 2 weeks, it's probably not going to work, and you can come back for a touch-up. So these angry lines here, crunch really hard. You can see that these vertical muscles right here are really kind of strong for her. And what we're going to do is get these lines right across here. So relax. So right across here. Put the needle in. Did that hurt much?
Mm-mm.
Okay, so again, get those muscles directly. Inject it a little bit as I withdraw, and what that does is it reduces the bleeding to a large extent. You can see she's not bleeding there at all. Turn around here. The length of this muscle is long. You can see that right across here. And so you try to get all the way across. As long as you get across, try to avoid as many needle sticks as possible. Okay, across here, this is the base of the muscle. And we can treat the bunny lines that way, as well as for her, this actually is the kind of the strongest area of the muscle. And we'll get rid of that. Okay? And for her forehead, what we're going to do, raise your eyebrows. Okay? So you can see her lines start about there, so relax. Right there. And I give most of my patients a little bit of a bonus if possible, which is to say I put one right at the tail of the eyebrow, and that's where the muscle is that pulls down your brow. And so if you relax that muscle, you actually get a little bit of a brow lift. And that's an effect that I think most of my patients appreciate. So, and that's really it for the Botox for those three areas.